So prostate cancer is known commonly as a cold tumor. We actually presented, data around the role of immune checkpoint inhibitors for, prostate cancer and other tumors known as cold, where you do find what we believe is a biomarker of response. Whether you find MSI high or microsatellite instability or high tumor mutational burden, they do help you to identify patients who will more likely benefit from therapy, from immune checkpoint inhibitors. But to be honest, the data in prostate cancer suggests as good as 50%. So there's still room to go. So even if you have, which is a rare event, about 2 to 3% of the times, you still have, half of the patients with that biomarker who are not going to respond. So in general, for unselected patients with mCRPC, there is no role for immune checkpoint inhibitors. With that said, I do believe that we're going to, as we understand more about the biomarker, whatever that biomarker might look like, whether it's tumor mutational burden, MSI high, or other things like, a multiple combination deficient, I do believe that we're going to find out, what is the fraction of patients that will benefit from checkpoint inhibitors. So I think in the future, we won't be using immunotherapy like immune checkpoint inhibitors for all. I think that number is likely going to be maybe higher than 2-3%, but we still need a way to go to identify exactly, what is that fraction of patients with advanced prostate cancer benefiting from checkpoint inhibitors. But it's not ready for prime time beyond those two biomarkers that we know currently.